Hey, Alpha Nurses, I'm Licensure from alphanurseguide.com. This is 18 Practice NCLEX questions. Without delay, let's get started.
A client is becoming agitated during a discussion group. She states, "I know that all of you hate me." She leaves the group and goes to her room. Which action by the nurse is most therapeutic for the client? 1. After group, ask the client to talk to the nurse about her concerns. 2. Ask the client to return to group and share her feelings. 3. Explain to group members about the client's problems. 4. Ask the group members to apologize to the client individually. The correct answer is 1. It is appropriate to talk alone with this client about her feelings. A suspicious client is unlikely to agree to talk about feelings in a group. It is a violation of the client's privacy to reveal a client's problems to group members. The other clients in the group have no reason to apologize, and the nurse should not ask them to do so. A client reports having thoughts of being followed by foreign agents who are after his secret papers. Which response by the nurse is most appropriate when responding to the client's disturbed thought process? 1. I don't see any foreign agents. 2. I think these thoughts are frightening to you. 3. I don't know what you mean. 4. I'd like you to come to group with me right now. The correct answer is 2. The client's disturbed thought process likely reflects this client's paranoid delusions. The nurse should acknowledge that the thoughts are frightening the client. Telling the client the nurse does not see any foreign agents is an appropriate nursing response if the client is having disturbed visual sensory perception and is having visual hallucinations. Telling the client the nurse does not understand what the client means is an appropriate response if the client has impaired verbal communication. Suggesting that a client participate in group activities would be appropriate if the client had a nursing diagnosis of social isolation and was staying in his room. A client who has been stabilized on medications for several months is at the clinic for a medication check. During conversation with a nurse, the client suddenly jumps up, begins pacing, and wrings her hands. In what order should the nurse do the following interventions from first to last? 1. Walk with the client to help decrease her anxiety. 2. Discuss productive ways to solve her problems causing anxiety. 3. Share observations about her anxiety-related behaviors. 4. Ask the client about the sources of her anxiety. The correct order is 1, 3, 4, 2. The nurse should first walk with the client to reduce her anxiety because the client must be at a mild level of anxiety before learning can occur. Sharing observations with the client conveys a sense of caring. Later, the nurse can help the client connect the anxiety-related behaviors to her feelings of anxiety. Once the client can identify the source of her anxiety, she can talk about solutions. The parents of a 20-year-old female client diagnosed with paranoid schizophrenia admitted 4 days ago are attending a family psychoeducation group in a hospital. Which of the following statements by the mother indicates that she understands her daughter's illness and management? 1. I know that I'll have to do everything for my daughter when she comes home. 2. Tasks as simple as getting out of bed and showering in the morning may be difficult for her. 3. I know that visits from her friends at home should be discouraged for a while. 4. She won't experience a relapse as long as she takes her prescribed medication. The correct answer is 2. Clients with paranoid schizophrenia experience alterations in thought resulting in introspection, confusion, and distraction from external reality. Simple tasks that require concentration and effort, including activities involving self-care, may be difficult for the client, especially during the acute phase of the illness. However, the mother should not need to do everything for her daughter. Rather, the mother should encourage the daughter to do things for herself with guidance. Visits from friends should be discussed with the client, and the client should be encouraged to visit with friends to minimize the risk of social isolation. Although relapse typically occurs with medication noncompliance, vulnerability to stress, a low threshold for stress, the number of stresses, and the client's lack of adaptive coping behaviors contribute to relapse. When conducting a mental status examination with a newly admitted client who has an axis I diagnosis of paranoid schizophrenia, the client states, I'm being followed. It's not safe. They're monitoring my every move. In which of the following areas of the mental status examination should the nurse document this information? 1. Thought content. 2. Quality of speech. 3. Insight. 4. Judgment. The correct answer is 1. The client is voicing paranoid delusions of being followed and monitored. Presence of delusions is described in the area of thought content in the mental status examination. The speech section would typically include documentation of disturbances in speech or pressured speech. In the insight section, the nurse would document information reflecting a lack of insight. For example, statements such as, "I don't have a problem." In the judgment section, the nurse would document information reflecting a lack of judgment. For example, poor choices such as buying a gun for self-protection. A client states that she hears God's voice telling her that she has sinned and needs to punish herself. Which response by the nurse is most important? 1. How do you think you'll be punished? 2. Please tell staff when you think you need to punish yourself. 3. What exactly do you think you have done to be punished? 4. Let's talk about your strengths. The correct answer is 2. The client is at risk for harming herself because of the command auditory hallucinations. It is most important for the staff to know if she currently thinks she needs to punish herself. Then it is important to know how she thinks she might punish herself. Knowing what she thinks she has done is relevant for changing her negative thinking. Focusing on her strengths will help improve her self-esteem. A client diagnosed with paranoid schizophrenia is still withdrawn, unkempt, and unmotivated to get out of bed. A mental health aide asks the nurse why the client is this way after being on fluphenazine 10 milligrams for 7 days. The nurse should tell the health aide, 1. Fluphenazine is most effective with the positive symptoms of schizophrenia. 2. The client will be less withdrawn and unmotivated when the fluphenazine takes effect. 3. The client's fluphenazine dose probably needs to be increased again. 4. Lack of motivation is a common side effect of fluphenazine. The correct answer is 1. Fluphenazine is most effective with the positive symptoms of schizophrenia. Positive symptoms are those that are added to a person's experience, such as hallucinations, delusions, and disorganized thinking. The client's symptoms reflect the negative symptoms. Negative symptoms are things taken away from the person's experience, such as lack of emotional expression, lack of motivation or drive, and social withdrawal. Fluphenazine generally is effective in 3 to 7 days for the positive symptoms. An increased dose or longer time on fluphenazine will not help the negative symptoms of being withdrawn and unmotivated. A client reports that men in blue clothes keep looking in her window and talking about her. Which of the following responses by the nurse is most appropriate? 1. Those men are groundskeepers. They're talking about their work, not you. 2. Don't take things so personally. Not everyone who is talking about you. 3. Let's not pay attention to men. Let's play cards instead. 4. I'll close the drapes so you can't see the men. The correct answer is 1. The nurse needs to present the reality of the situation. By explaining that the men are groundskeepers and probably talking about work, the nurse is reinforcing reality to counter the client's illusion. Additionally, this response voices doubt in the client's paranoid interpretation. Telling the client not to take things personally is flippant and judgmental. Telling the client to not pay attention to the men fails to address the client's misinterpretations and misperceptions. Closing the drapes so that the client doesn't see the men ignores the client's misperceptions and misinterpretation. A client is sitting in the corner of the day room cocking his head to one side as if he hears something, but no one is nearby. The nurse suspects he is having auditory hallucinations. Which of the following questions should the nurse ask first? 1. Are you seeing someone other than me? 2. What are you hearing right now? 3. What is going on with you right now? 4. Do you want to go to the recreation room? The correct answer is 2. Before intervening with the client experiencing hallucinations, the nurse must validate what the client is experiencing. Asking the client what he hears right now accomplishes this. Asking about seeing someone near the client would be appropriate to validate visual hallucinations. Asking the client about what is going on may be helpful. However, the question is too general to validate that the client is experiencing auditory hallucinations. Asking the client if he wants to go to the recreation room might be appropriate after the nurse has validated what the client is experiencing. An outpatient client who has a history of paranoid schizophrenia and chronic alcohol dependency has been taking risperidone for several months. She reports that she stopped drinking 4 days ago. The client is very frightened by the tactile hallucinations of bugs crawling under her skin. Which of the following factors should the nurse incorporate into the plan of care when explaining the tactile hallucinations? 1. Alcohol intoxication. 2. Ineffectiveness of risperidone. 3. Alcohol withdrawal. 4. Interaction of alcohol and risperidone. The correct answer is 3. Tactile hallucinations are more common in alcohol withdrawal than in schizophrenia. Therefore, the nurse should explain that these hallucinations are the result of withdrawal from alcohol. Because the client stopped drinking 4 days ago, the client is not intoxicated. Risperidone has little effect on symptoms of alcohol withdrawal. It is prescribed for symptoms of schizophrenia. Alcohol and risperidone have an additive effect, not one of causing hallucinations. In a family education group for those who have relatives with paranoid schizophrenia, which of the following comments indicates the need for further teaching about symptom management? 1. When the clients get overwhelmed, it's best that they spend some time in their room. 2. The more we push the clients to spend time with friends, the more their voices decrease. 3. Until we get the clients up and going, they seem to have no motivation to do anything. 4. We still have to remind the clients that we don't hear the voices they do. The correct answer is 2. Pushing a suspicious client into social situations is likely to increase anxiety, which increases, not decreases, the hallucinations. The statement about spending some time alone if the client is overwhelmed indicates awareness and understanding of how to intervene when the client is exposed to stress. The statement about lack of motivation indicates awareness and understanding of avolition. The statement about reminding the client that the family doesn't hear the voices indicate awareness and understanding of the client's hallucinations. Which of the following statements indicates increased insight by the client about her newly diagnosed paranoid schizophrenia being stabilized on medications? 1. Now that the voices are gone, I can decrease my medicines. 2. I would feel better if I knew that the food wasn't too dangerous to eat. 3. Since I feel better, I know I can restart school next week. 4. The voices go away when I tell them to, except if I'm really nervous. The correct answer is 4. The statement about the voices occurring if the client is nervous reflects awareness that stress and anxiety can increase the positive symptoms of schizophrenia. Decreasing the medications because the voices are gone reveals a lack of awareness about the need for the medications to control the client's symptoms. Stating that the food is dangerous to eat demonstrates a lack of insight into the client's delusions. Restarting school in a week reflects an unrealistic expectation for a client who is newly diagnosed and being stabilized on medications. The parent of a young adult client diagnosed with paranoid schizophrenia is asking questions about his son's antipsychotic medication, ziprasidone. Which of the following statements by the father reflects a need for further teaching? 1. If he experiences restlessness or muscle stiffness, he should tell the doctor. 2. I should give him benztropine to help prevent constipation from the ziprasidone. 3. If he becomes dizzy, I'll make sure he doesn't drive. 4. The ziprasidone should help him be more motivated and less withdrawn. The correct answer is 2. Constipation caused by medication is best managed by diet, fluids, and exercise. Benztropine can increase constipation. However, it may be prescribed for restlessness and stiffness. Restlessness and stiffness should be reported to the primary healthcare provider. Drowsiness and dizziness are adverse effects of ziprasidone. Clients should not drive if they are experiencing dizziness. Ziprasidone does help improve the negative symptoms of schizophrenia, such as avolition. A client newly diagnosed with tuberculosis is being admitted with a prescription for isolation precautions for tuberculosis. The nurse should assign the client to which type of room? 1. A room at the end of the hall for privacy. 2. A private room to implement airborne precautions. 3. a room near the nurse's station to ensure confidentiality. 4. A room with windows to allow sunlight. The correct answer is 1. Implementing airborne precautions for possible TB requires a private room assignment. In addition to isolating the client by using a private room, engineering controls can help prevent the spread of TB. A room at the end of the hall will aid in controlling airflow direction and can prevent contamination of air in adjacent areas. Confidentiality is provided for every client, regardless of the client's room location. Sunlight is not a component of isolation precautions. The nurse is reviewing the history and physical and physician prescriptions on the chart of a newly admitted client. The chart reads, 19-year-old reports a constant cough for the past few weeks with dark sputum for the past few days. Has night sweats, 10 pounds weight loss in the past month, and always being tired. He took 1 Tylenol about an hour prior to arrival. BP is 120/64. Heart rate is 84 with regular rhythm. Respiration is 26, unlabored. Slight wheezing in right lower lobe posteriorly. Oxygen saturation is 92%. Temperature is 99.9 degrees Fahrenheit orally. Skin is warm and slightly diaphoretic. The patient has non-productive cough at this time. Nursing assessment reveals possible respiratory infection. The HCP orders chest x-ray, sputum specimen, and oxygen at 2 liters per nasal cannula. The nurse should first 1. Initiate airborne precautions. 2. Apply oxygen at 2 liters per nasal cannula. 3. Collect a sputum sample. 4. Reassess vital signs. The correct answer is 1. There is a high risk and potential for tuberculosis, and airborne precautions should be implemented immediately to prevent the spread of infection. After initiating precautions, the nurse can start the oxygen, check the vital signs, and collect the sputum specimen. A client is receiving streptomycin for the treatment of tuberculosis. The nurse should assess the client for 8th cranial nerve damage by observing the client for 1. Vertigo. 2. Facial paralysis. 3. Impaired vision. 4. Difficulty swallowing. The correct answer is 1. The 8th cranial nerve is a vestibulocochlear nerve, which is responsible for hearing and equilibrium. Streptomycin can damage this nerve by ototoxicity. Symptoms of ototoxicity include vertigo, tinnitus, hearing loss, and ataxia. Facial paralysis would result from damage to the facial nerve. Impaired vision would result from damage to the optic, oculomotor, or the trochlear nerves. Difficulty swallowing would result from damage to the glossopharyngeal or the vagus nerve. The nurse should teach clients that the most common route of transmitting tubercle bacilli from person to person is through contaminated 1. Dust particles. 2. Droplet nuclei. 3. Water. 4. Eating utensils. The correct answer is 2. Tubercle bacilli are spread by airborne droplet nuclei. Droplet nuclei are the residue of evaporated droplets containing the bacilli, which remain suspended and are circulated in the air. Dust particles and water do not spread tubercle bacilli. Tuberculosis is not spread by eating utensils, dishes, or other fomites. The client with tuberculosis is to be discharged home with community health nursing follow-up of the following nursing interventions, which should have the highest priority. 1. Offering the client emotional support. 2. Teaching the client about the disease and its treatment. 3. Coordinating various agency services. 4. Assessing the client's environment for sanitation. The correct answer is 2. Ensuring that the client is well educated about tuberculosis is the highest priority. Education of the client and family is essential to help the client understand the need for completing the prescribed drug therapy to cure the disease. Offering the client emotional support, coordinating various agency services, and assessing the environment may be part of the care for the client with tuberculosis. However, these interventions are of less importance than education about the disease process and its treatment.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.